And there are best and worst case scenarios. Here's the worst.
Okay, live in Canada, so figured I'd react to this.
This pandemic, which may last for 18 months or even 2 years, because we may have a smaller secondary or tertiary wave. Had we done nothing, Ontario may have suffered 100,000.
Don't live in Ontario, but figured I'd react to this because this seems bad.
100,000 deaths in a pandemic that could last 18 months to 2 years. That's if no measures were put in place to slow the
2
spread.
years.
Of course, there are measures in place. The economy has been virtually shut down, and everyone's been told to stay home and stay physically distant. If that continues, and if we all obey the public health measures, the Ontario death toll is still projected to range between 3,000 to 15,000.
In one fucking city.
To many people, these will be shocking figures. Where we end up depends on all of us. If we follow the rules, if we do our best to socially distance, we can get within that range, and we can strive to get as low as possible within that range.
Sad that we're aiming for. We're not aiming for no death. We're aiming for as least as possible.
Ontario's premier was explicit. It is everyone's duty to slow down the spread of the virus, and more restrictions are coming. All industrial construction sites, except for critical projects like hospitals and transportation, will be shut down this weekend. Ford says when he saw the projections, he knew drastic action had to be taken.
Lock down
Over
everybody.
1,600 people could be
Make
dead
it by law. Everybody has to
by
stay
the end of
inside.
April. That's 50
Give
a day.
everybody,
That's 2 people
send every
hour.
person that every
Never in
apartment
our
building,
lifetime
every
have
house,
political leaders
a
had to
couple
make
grand
life and
food,
death decisions like they are
like
in
literally
this
drop
pandemic.
food off at people's
Eric
doorsteps.
Sorensen breaks down the
Drop masks
Ontario
off at people's
projections
doorsteps.
and what needs to happen to prove them wrong.
Maybe that will help. And make rent and mortgages free for a month.
The worst case, almost unthinkable.
To
A best
stop
case,
the
still shocking.
plague,
In this province,
you have to put the entire country on pause. That means nobody loses the house because nobody pays rent, nobody pays mortgage. They just live where they are. It's like everybody's a squatter pretty much.
The situation is extremely serious.
Everybody gets food dropped off. Everybody gets the utilities keep going.
With going to the beach.
That would slow it down.
With having
But that's a shitload of legal red tape they have to
in
jump
the
through.
basement. The answer is no.
Like every province, it is touch and go whether Ontario hospitals will be able to accommodate the surge in patients who will need intensive care beds soon. Here's the current situation in Ontario. Right now, there are just under 200 COVID-19 cases confirmed in ICU beds. The capacity in the province has another 400 beds available. In a best-case scenario, though, the capacity is not going to be enough. The number of cases this month is projected to rise above 1,000. However, there is also a plan for an additional 900 beds to increase that capacity to meet with enough beds for the people that will need ICU treatment.
Yeah, they're aiming for best
In a
case
worst-case
scenario.
scenario, however, there will not be enough beds available, which is why in this province and across the country, the measures being taken are so important. Ontario hospitals have permission to increase capacity quickly.
Some of them are using space in retirement homes, and some of them are actually creating field hospitals.
There is reason for optimism. Early projections look even worse.
Very clearly, the pain we've gone through in the last 2 weeks has been largely successful. So we have dramatically changed the course of this epidemic
Part 1.
Here in Ontario.